question answer session in the end, 5 minutes.
Okay.
Which is mentioned in the manual.
Okay.
It's not mentioned here.
5 minutes.
Has it started already?
So I'll add 5 minutes more for the question.
Yeah, you can start again. Alright, so before I start, yeah, last time, please. Madam Toastmaster, fellow Toastmaster and dear guests, you can note down questions if you get any in between because I want to use those 5 minutes, okay? It will be a favor, just do it for me.
Okay.
Okay, so what I'm going to talk about, it looks complicated, right? Does it? That was the main motive because it's supposed to be technical, okay? So I'll try to simplify it and put forward to you. Okay, let's start with it. Now, may I ask you, how many of you know people who have hypertension in your family, in your relatives, in your friends?
Okay.
Hypertension means Kaushui, right?
Kaushui,
High
yeah.
blood pressure. High blood
High
pressure.
blood pressure.
I'm sure everyone knows someone who has or who had. Yes. Right? You know, at least one person. So it's quite common. That proves it's common. Okay.
Yes.
And do you know what it can do to you? Do you know what it can do?
You can get a stroke from that.
Okay.
You
Yeah.
get
All right.
a lot of problems.
Yeah. Yeah. Let's see what it can do. So let me present us the story of a handsome guy. He was 35 years old, fair, brown hair, brown eyes, but he was Indian. And he came to a hospital with severe headache and a little bit of chest discomfort, not pain, discomfort. He came to the hospital and the doctor said, you have to be in the hospital for at least 1 day and you cannot go back home right now. And he was a businessman. He did not want to stay. And also it was a private hospital, so it was quite expensive and he didn't want to pay that much. And he thought he was quite healthy because he was not so fat. He was like, okay, chubby guy, but still healthy. So he said, no, I don't want to stay. So the doctor said, okay, if you want to go, we cannot let you go. But if you want to go, you have to sign and say that it's at your own risk and we won't be responsible. And then he said, okay. And then he signed and went back to home. Next morning, there was an ambulance which came to the same hospital and they saw the dead body of the same guy. And it was shocking for all of them. Although it is rare, but it happens. And although it's rare, but it was shocking for all of them. So, let's see what happened. Why did we talk about that guy? Now, what is hypertension? Just to break down the word, hyper means high, tension means pressure, like high pressure, okay? So, in common words, we call it high blood pressure. So what happens? Look at this pipe. When there is high pressure, if there is any weakness on the pipe, it just breaks and come out. The same here. It can damage the vessels and break it. So that's what happens with the blood vessels. When you have very high blood pressure, if there is any weak point in the blood vessel, it will just break it and it will cause something called hemorrhage, okay, which is like the break down the vessels and the blood come out. Okay, do you know anyone who died of hypertension, high blood pressure? Do you?
Yes.
You know. Okay, only one person out of
No.
so many. You saw, right? You know, right? Okay, we'll come back to this. See, the problem is, why did I say it's slimy? It's not slimy, it's slimy, like something very slippery, it goes out of you, it doesn't reach you. So it's a very smart disease. Although it's very dangerous, you don't know it's dangerous because one of the problems is it does not cause any symptom. If for instance I have high blood pressure now, I don't know it because I'm okay. I don't get any symptoms. Like 90% of the time or 80% of the time there is no symptom. The people who have symptoms are actually lucky because they go to the doctor or check themselves and they find out they have high blood pressure. That's why I say it's slimy. Another reason it is slimy because there are many people who die of high blood pressure, but the high blood pressure is never blamed for that. The reason is this. When there is high blood pressure, the pressure increases in the blood vessels, in the blood pipe, in your brain, in your kidney, in your heart, and there can be breakage of the blood vessels which causes stroke in the brain, okay, which causes heart attack in your heart, which causes kidney failure. And when you ask how did the person die, you get the answer like the person died of stroke. the person died of heart attack, and the person died of kidney failure. But where is the hypertension? Because that was the main culprit. It was not the kidney failure with which that person was living all these years. It was the high blood pressure. It was not the stroke with which the person was living for all these years. It was the high blood pressure. So actually that was the main reason of that, but these are the consequences. And we know them by consequences. So hypertension, people think, okay, leave it, I took the medicines, my blood pressure was high, my doctor gave me and I'm okay now, I don't have any symptom, why should I take the medicines again? So most of the people have this kind of mentality. Oh, Jerry. Okay. So you know what makes it slimy, right? That's the reason, because number one, it's asymptomatic. You don't get any kind of symptom. You're okay with it. Number two, when it causes death, the blame is on some other disease. It's not on hypertension. And so people we know people who die of cancer, and we say, oh, they die of cancer is very dangerous. But this is also dangerous, okay? Okay, now when you go to the doctor, you ask, what should I do? So the answer can be,
Maybe.
don't eat salt, no sugar, no fats at all, no cookies, pastries, cakes, chocolates,
Oh, very practical.
right? No beer, no wine, no coke, no water, no sorry, you can drink it. No butter, no cheese, no carbohydrates, okay, nothing sweet. Diabetes.
So what left?
Okay, I'll say why sweet thing, I'll come back to that. Okay. I'm sorry?
No, I think the only thing left is vegetables.
Okay, let's come back. Okay. No stress,
No,
no smoking, no potatoes,
the potatoes.
no curd, no yogurt.
You simply have to eat anything.
You just
Run 50 kilometers every day. 5 kilometers every 3 times a week. Okay? Walk 1,000 steps daily, eat salad, stay fit. Okay? Sleep early, get up early. Don't watch movies. Don't eat outside, no stress, no work, leave your job, sorry, you can work. Eat less, don't eat at all. You can eat less. Go and die. Don't have it. But see, it's cancelled. Sometimes they say out of emotions, okay? So every time you take something like this is what happens, you know? That's something about it. Okay, so those are the things which is safe. So I'll simplify it for you, what we can do so that we don't have to do so many things, okay? Now let's have a check. What can you do? Number one, this is the boring side of it, okay? Number one, check your blood pressure regularly. But if you're younger than like 35, 40, you may decrease the frequency, like once a year would be okay. Okay. Number two, take your blood pressure medicine as directed. If someone is on medication, like 45, 50 plus 60 or something, you have to continue with the medication. Don't stop it without doctor's advice. Okay. There are very few patients who have to stop the blood pressure medication with doctor's advice. Otherwise, it's sometimes impossible to stop. Okay. Number three, eat healthy. Now, the main aim of eating healthy is to maintain your weight. Okay. So you can eat chocolate or cake today, but you can exercise more, or you can balance somewhere. Okay. So that should be okay, but it's not like you eat chocolate every day or cake every day, because then losing weight becomes difficult, and also it becomes a habit. Okay. And also that increases cholesterol, which forms a layer inside the blood vessel, and that can further increase the blood pressure. Okay. Achieve and maintain a healthy body weight. Very important. Number 5, 30 minutes of moderate physical activity. 30 minutes of moderate.
Walking,
It can be walking, jogging, skipping, frisbee, whatever. So,
skipping is not moderate.
No.
so it depends on the definition. You know, how you define moderate. So it should peak your heartbeat of at least up to 120, 130. That can be considered moderate. Now, quit smoking, because smoking does the vasospasm, like it decreases the diameter of the blood vessels. Okay, so that's why you have to stop smoking. Avoid secondhand smoke, like if someone is smoking, you should avoid getting the smoke into you. Number 8 could be manage stress, activities you find relaxing. Okay, stress, how does stress relate to hypertension? Do you know? How does stress increase the blood pressure? Because stress is something inside the brain.
Heart and pound faster.
Yeah, so what happens when you're under stress? There is a gland in your body which secretes steroids. Okay? And whenever you're in stress, that corticosteroid or steroid comes out, and that is directly responsible for decreasing the diameter of the blood vessels. Okay? So once the cortisol is high, the diameter decreases and the pressure increases. Okay? So that's how it works. So relaxation is very important to relax your blood vessels so that the pressure falls down. Okay, I hope you got it, right? Limit the amount of alcohol. 1 drink a day for women, 2 and 2 for men. So it depends on the size, you know. All right. So to take help if you need any. No, my point was, see, 2 things you can do is number 1, measure your blood pressure. Okay, and number 2, check your waist size. The size of your waist. If any one of those is above normal, you have to see a doctor. Okay? So for Chinese, Asian, South Asian people, it's 32 inches for the females and 35 for men. If it's above that, you have to take care of your waist size.
Nothing to do with the height?
No, waist size you have to. I mean, that's the standard mark. So if it's just give me 1 minute. So 32 inches for females and 35 for men. And for like in general, because Asian people, we are a bit, you know. So on the other side is 35 and 40. So if this increases, you have to take care of it. Or if the blood pressure goes high, you know what is the normal range of blood pressure? The level?
60 to
90.
No, it's 120 by 80. 120 by 80. Okay, so
the 80 is too low?
stay. 120 is the higher limit. 80 is the lower.
I don't want 60. Sorry.
No, 180 to 120 by 80 is the normal. Okay, so that's the 2 things you have to do. Even if you eat, even if you sleep a lot, watch a lot of movie, but try to balance your waist size and also check your blood pressure at least once. So what you have to do is the action is check your waist size and take a machine, digital machine, and keep it at home. Check for your mother, father, your parents, loved ones, whoever you want. So go to the Taobao, get a digital blood pressure and check your family members' blood pressure and your loved ones. And also you can get a measurement strip if you don't have, and check your waist. Thank you very much, and these are the options you can have. Thank you for listening. If you have any questions, please.
Yeah, there's my
Please.
to the moment.
So I have 5 minutes for that. We can adjust.
Oh, yeah, sure, no
Yeah.
problem.
You mentioned the healthy range of our blood pressure, like high 120 to 80, right?
Right.
So then, what is the minimum of high?
What is the
Minimum
minimum?
of
Yeah, if
blood
it's
pressure.
above 100 or if it's above 90 and there is no symptom, then we don't have to worry. But if there is symptom, we have to worry. It should not be less than 90, the upper limit.
Yeah.
Okay? But many people, many females especially have the blood pressure like 98, 99, the upper limit.
Yeah,
Okay,
because
100.
the reason I'm asking is
Yeah.
my normal blood pressure is 60 to 90.
Yeah, exactly. I know many people
wait,
who
is
have
that-
that,
is
but
that
they don't have
unhealthy?
any symptom. Yeah. So if it's low and if there is no symptom like lightheadedness, weakness, then it's not a problem. But it's recommended that you try to increase your blood pressure by taking more electrolytes, a bit of more salt in your diet, a bit, you know, so that you can raise the blood pressure by like 5 millimeter mercury or 10 millimeter, and you can achieve like 100, 105 or something like that. Okay, so that's like a healthy range, trying to be close to the normal limit. But if you don't have any symptom, if you're above 90, it's not a problem.
What's your advice to decrease the blood pressure if it's already very high?
If it's very high, you know, one of the most important things that can help you is not the medicine, but you have to take the medicine.
Just to eat like a rabbit.
No, it's not like rabbit. See, human stomach is made for 3 things: water, air, and food. Okay?
What's the second one?
Water, air,
Air.
and food. Okay? So 1/3 is for water, 1/3 is for air, and 1 is for food. So you know, so what we have to do is we should try not to eat a lot and try to control it. So diet is a very important factor actually. You know, sticking to normal cooked food, non-processed food is the best thing. like avoiding chocolate chips, biscuits, and all those pizzas and burgers is the best thing you can do. Actually. Right. So that is it. So that, and the walking and exercising if you can.
And the question is, the reason why we have moderate sports is to increase the flexibility of our blood vessels, right?
Yeah, one of the reasons is this.
Yes.
One of the reason is this. Another reason is to make your heart stronger. Okay, because if your heart pumps like 180 or 170 times per minute, which can happen when you are exercising, it gets enough strength, and also it provides strength to the blood vessels. And another reason is it releases some hormones in your blood. It releases some hormones in your blood, which is healthy for your blood vessel and the entire system. And also it increases your lung perfusion, the lungs, which is connected to your heart. Okay, if you don't have lungs, how will you exchange your air, right? And all the vessels which is going from your heart to the lungs should be healthy. So to exercise your lungs, like open up, close, all those things get into shape if you do exercise. That's why it's important. Right.
Is it a genetic disease? I mean, whether I could start it easier if my parents both have the problem?
Yeah, it is attributed to genetics as well, but less stronger than diabetes. Okay, for instance, my father and mother has diabetes, I'll definitely get like 90% of the chance that I'll get it. Okay, but not so with hypertension. Hypertension is more dependent on your lifestyle and the risk factors. Okay, so if you are not living a healthy lifestyle, if you are not active physically, then you will have problems. So that is the thing. And one more point I'd like to add, I said about sugar, right? Hypertension is very good friend. Hypertension is very good friend with diabetes. And also diabetes is very good friend with hypertension. So if you have diabetes, there are very high chances you will develop hypertension. And if you have hypertension, very high chances you will get very good friends. If one comes, the other will be like ready to go. Yeah. So that's why.
One last question. Is there any tip, like because you were saying that the stress is very bad, right? But in some cases, you cannot avoid the stress. Like example, I was very much afraid of height, and I was on a very high place, and I could felt my heart was shrinking. I think I was going to die. But at that moment, is there any tip like you relax?
Like we are not talking about occasional stress. We are talking about continuous stress. Okay? Like you go home, you're frustrated, you're not happy with your and you're like in stress. You take your food, you're not enjoying, you're sleeping. You know, getting up morning, you just go to work and stress. So it's like continuous. You know what happens when you have stress? The cortisol goes high and the blood vessels constrict, and that keeps your blood pressure.